steal my, we're going to get my slides here and then steal this thing. Thank you, Bob. Those are very kind words. I'm wondering if Maria put water all over my check too. Okay. No check? No, that's good. So when I started, getting up here is kind of like getting on an airplane, or getting off an airplane, I should say, in a foreign country. Do you have anything to declare? How much money did you bring in? You know, that sort of thing. So when I said yes to this, and I said, oh, I'd like to do something, you know, not talking about what I did in my practice, but talking about other things. And they said great, which was fantastic. And then I picked the subject that you can see on the board here. And this is not, I wasn't trying to say that I was always thinking about, you know, well, I was always thinking about doing no harm, but I'm not. I'm up here like Simon Estes was last night when he was talking about his life experience, and George Shirley also, two great opera singers and stars, and what they got back, they gave out right away. So I'm hoping that by 12 o'clock, you'll say like I did after they were done with their talks, thank God for these people. And you won't say, thank God he's over. Well, you could say that too. But at any rate, we can go on. And, oh, I have disclosures at first. That's why I started with the airplane thing. The disclosure is I did not model for that statue. It is an old statue of Hippocrates. Okay. So, what does it take to be a physician? And I think we can broaden that out to everybody in this room. What does it take to be an SLP? What does it take to be a voice teacher? Can anyone be a physician? Should anyone be a physician? Why would anyone want to be a physician? And do we need physicians right now? Or is the internet okay? Sometimes I wonder. So I went back to the start, and my other bias is that I'm Greek, and all the people that started this stuff were Greek. And so I wanted to go back and talk about my ancestors too. So in one way or another, we all came from the same place. So there's one thing I want to get out of the way first, and that is the difference between philosophy and ideology. You hear a lot about ideology today, but philosophy in the Greek form is the love of wisdom. Started in the 5th century BC, and it's the rational investigation of the truths and principles of being, knowledge, or conduct. They divided, the ancient philosophers divided their field into natural philosophy, moral philosophy, and metaphysical philosophy. Natural philosophy, the height of natural philosophy was taken to be the medical field. And the example of moral philosophy was law. I'm not sure that fits today. But the metaphysical philosophy obviously is theology. That's opposed to ideology, which got its start, if you will, as a word, even in 1796. The original definition of ideology was a philosophy of the mind which derives knowledge from the senses. Other philosophers earlier had called it sensation knowledge. And it was brought out by this French philosopher, and I'm sorry I didn't get to Jean Abibal before so that he could teach me how to pronounce his name, but I'm going to just leave it. In 1909, the definition of ideology became, or had morphed into, a systemic set of ideas and doctrines, and by 1970, it was a prescriptive doctrine that is not supported by rational argument. So this is not an ideology that we're going to go through today. It's a philosophy. Started with Socrates. And Socrates and Hippocrates, by the way, were alive at the same time. So these two men were able to talk to each other like we are able to talk to each other today. Socrates said the art of medicine does not produce health in the sense that a sculptor produces a statue. Instead, it imitates nature by cooperation with the natural processes, and it guides the natural processes to enable a natural result more surely than if it was left to chance. In other words, we try to modify what the patient is doing so that the patient can get better. We can't, make the patient get better. A contemporary of Socrates, again, was Hippocrates. You can see all of the dates down below. Born on the island of Kos, one of the Greek islands, he was an Asclepiad, which meant he was a member of a family that put its lineage back to the god of health, Asclepius, or he was in a guild that was called an Asclepiad. He was both a practitioner and a teacher, traveled all over Greece and all over the Greek Isles. I mean, he was all over this entire area, collecting and treating sick people. He didn't collect the data from the sick people. So he said that medicine is both an art and a science, both in origin and development. So the roots of medicine are art and science. And we'll go through that in a little bit, and we'll kind of parse out what's science and what's medicine, and what's art. With regard to disease, the physician must have two special objects in view: to do good and to do no harm. We all take that, the Hippocratic Oath, well, maybe some of the, well, all the doctors do, at least we used to in the past. And we'll go through the Hippocratic Oath in a minute. Galen, who lived after these fellows, we're talking about AD now, back in the 2nd century AD, said that the comprehensive education of he had a comprehensive education as a physician and a philosopher. Traveled widely, but he settled down in Rome. Pergamon today is one of the cities in Turkey. So he also traveled. He practiced humorism, which is not giving people, making people laugh. It meant that he was practicing the same thing that the other ancient philosophers and doctors practiced, that there were 4 separate humors in the body: black bile, yellow bile, blood, and phlegm. This was their these were their thoughts. His anatomical reports actually lasted all the way down until Andreas Vesalius in 1543 was able, at that time, to start dissecting human cadavers. Before that, you couldn't dissect human cadavers, so all of what Galen did was on animals. As a science, medicine involves knowledge of the cause of the disease, the different kinds of diseases, their characteristic courses. Without such knowledge, diagnosis, prognosis, and therapy would be a matter of guesswork and chance. The practice of medicine requires an art, in addition to the science, the art based on science but going beyond science, formulating general rules, actually philosophical rules. Baruch Spinoza, who was actually of Jewish descent, born in Portugal, and went to France first in the late 1500s because of the Inquisitions in Portugal, and from France to Rotterdam in the Netherlands, and then on to Amsterdam, was present during the Dutch Golden Age, and completed his masterwork on ethics. So if you want to know anything about ethics, Spinoza is the man. And he said that knowledge is, we're talking about the knowledge of the medical field, any knowledge actually, but especially in our field, opinion, reason, and intuition. Opinion was sense experience, reason was the things perceived in their connections under the general laws, and intuition was something that you would think about immediately. It just, you knew it was right. René Descartes, born in France, had a Jesuit education, a law degree, traveled with the Dutch army. Why did he get up there? Because this was, again, the time where people were being persecuted in these countries, and the Netherlands was one of those countries that allowed you to practice your religion freely. And this also was the, and they still do, I think, this also was the height of the Dutch Republic and the golden age of the Dutch. Medicine is knowledge in the service of mankind. It brings about preservation of health, which is without doubt the chief blessing and the foundation of all other blessings. So we're in an important field. It started a long time ago, and the people that have been in that field since the beginning have followed pretty much the Hippocratic Oath that we can go back to teach knowledge of the art only to those bound by the oath according to the law of medicine, to give those treatments considered to be for the benefit of the patients, not to cause an abortion or help a patient commit suicide or give counsel in that regard, to act honorably in the homes that they enter, and to keep secret all that they hear and see. So, knowledge of the art, giving treatments and benefit, not causing harm, acting honorably, and keeping secrets. The Cliff Notes version is know the science and art, do good, do no harm, act honorably, which is virtue, the definition of virtue, and keep the patient's confidentiality. So as far as the knowledge goes, the Hippocratic school, under Hippocrates, saw that knowledge was of the whole body. They took the human being as the whole body and not just a part of the human being. They looked intensely at the diseases and followed the disease process along. They also looked at the person, where the person came from, you know, what the air quality was, where they lived, what kind of water they were drinking. They gave treatments, whatever they could, and they followed the recovery so that they knew which treatments would be better than others. It breaks down into philosophy here of knowledge, good and evil, and virtue. So the components of medicine have always been disease, the patient, and the physician. People are individuals, and it's a very important point. You'll hear it over and over again. And the good physician modifies his care according to the patient's response to the treatment and the physician's own experience. This is probably old, I hope this is old news for everybody in this, or most people in this audience, because this is what we do every day. Clinical observation was the knowledge that was gained for medicine. They did it methodically. They classified fevers of different types, described the course, the phases, the critical points, the duration, and the recovery of the patient. The prognosis they could give to the patients ahead of time because they had followed other people who had had the same kind of problems. And they gained the patient's confidence, and because the patient, they understood, had to help with the disease. As an aside, when I was an intern, we took care of an elderly lady who had, as it turned out, lymphoma in her belly, and at that time, we did an operation to take out the lymph nodes and make sure it was a lymphoma. And for 7 days, the lady stayed in bed, the lights were off, she thought she was going to die. Until the 7th day, where she finally realized that she wasn't going to die, and the next day, she got out of the hospital because she wanted to get out of the hospital. The patient has to help us. They have to also follow what we say. So the patient is an individual. The relevant circumstances of the patient's life, and I'm sorry, I didn't give another, it's not a bias, it was one of those things that you say when you go through and enter another country. All of this is in philosophical terms from ancient days. So this is, you will see his, him, man, you'll see all of that. Please, ladies, this includes you. Up until 20 years ago, everybody understood that mankind meant everybody. So we're not leaving you out, and you don't get off the hook either. Particular characteristics of the disease and the body's reaction to it. The time, I put this in because it's a busy slide, and I love not busy slides. And I did that to show you how many things they always got on every patient that came in. But the medical art they understood was particularly one thing, and that was what we call today time in grade. It means you have to get in and you have to practice, and with practice we get better. And it's not that we know everything when we come out of medical school, because I thought I did, but there's no way. You only learn through experience. Everybody has to go through it, and that's why the field is so great. It's because we all have to go through it, and we all have to keep on learning. Individual cases are supplemental. There were treatment fads, if you will, in ancient times, just as they continue today, and we all have seen it. Bad physicians in the past got away with bad diagnosis and treatment in strong and healthy patients, but not so much in sick patients. And that's still the same today. If you're not doing the right thing, you're not going to get away with it when you get somebody that's really sick. And this was something that I came across as I was researching this, and I thought it was good to bring forth. Has pretty much nothing to do with the rest of the talk. But originally, men and women ate the same coarse grains as the ox and the horse, but gradually they discovered or prepared food more agreeable to their nature. They learned the hard way, many of the weaker constitutions failing to survive the rough fare. That phrase there was written by Hippocrates, not by Nicolas Maragos, who wrote The Big Fat Surprise in 2014. And if you haven't come across the book yet, you'll realize that what we've been doing for the last 38 years that we've been told to do, we have been doing as far as our diets in this country of America as well. But if you read her book, you'll find out that the reason that we're all overweight today is because of what the government told us to do in 1980. So read the book. Bad medicine. The ancient theory of medicine, the physician is the servant of nature, not its master. The physician strengthens nature. The patient's regimen was stressed. And you've all heard this because it was the first slide of Socrates. So these two people thought exactly the same way. What did the ancients know about medicine? This will surprise some of you. Persons who are naturally very fat are apt to die earlier than those who are slender. Old people, on the whole, have fewer complaints than young people, probably because the ones that had more complaints had already died away. But those with chronic diseases that befell them generally had diseases that never left them. Changes of the seasons were mostly engendered diseases, and the physicians could predict what kind of disease would occur depending on whether it was seen in the previous seasons in different places and to other people. And they followed this. Water in different places, some of it was good, some of it was bad. The peoples of Europe are more diverse in stature and shape from one another than even in the same city. Did you know that? So they were more integrated in Europe before that. The Greeks just stayed to themselves, I guess. Asiatics were more unwarlike than others and gentler in nature. And the ancients really did see a lot of evidence of genetic variance and inbreeding, but they explained it as secondary to the local environment and to food. Men and women became more wild, unsociable, and passionate with weather changes. Remember what happened in New York City with the blackout a few decades ago. If you wish to ascertain if a woman is with child, give her some hydromel, which is mead, honey and water fermented together, to drink when she's going to sleep and has not taken supper, because if she be seized with tormina, which is a severe bellyache, she was with child, otherwise she's not. I think we have easier ways to do that today, thankfully. And humans that are independent and enjoy the fruits of their own labors are, above all others, the most warlike. For these encounter dangers on their own account, bear the prizes of their own valor, and in like manner endure the punishment of their own cowardice. So, how do we know that we're learning about the science how do we get that knowledge? First of all, the philosophers through the ages have said that all men and women, by nature, desire to know. Knowledge is good. The possession of knowledge contributes to the happiness of men and the welfare of the state, but there are limits to a man's capacity to know. Aristotle, who was born in northern Greece, gave us the first comprehensive system of Western philosophy. He had a huge library that he put together in Lyceum, and his books, he had over 100 books, hundreds of books. They were all in the library in Athens. So again, Aristotle, born in northern Greece, had somehow made it down to Athens, which was the center of the universe at that time. And he founded the school, the Peripatetic School of Philosophy at the Lyceum. The Lyceum was a temple to the god of Apollo in ancient Greek mythology. And inside the temple, he had his huge library, all done on papyrus and written out. Does anybody remember what peripatetic means?
Yes.
Yeah, good. Thank you, Mara. It means when they were giving talks, they walked around. We're not peripatetic up here, I guess. We're staying So he recognized, or thought he recognized, three types of knowledge: theoretic knowledge, productive knowledge, which was knowledge of technical things, or practical knowledge, which they call moral. The names of the different types of things changed through the years with different philosophers. By the time we got to John Locke, who is actually one of the, if not the most famous philosopher of this area, because he gave us the two treatises on government and actually the form of the American government system. He was from England, homeschooled, had a bachelor's degree, and continued his studies on Oxford. He actually wanted to go into medicine, but then never got there. He was taken under the wing of Lord Ashley in England, which at those times you needed to have somebody to allow you to go and just look at books and do philosophical things. He fled to London with the fall of, well, when Charles I came in and took over his father's land forcefully. Returned after the English Revolution in 1688, which he was probably part of, and retired to his home and wrote most of what he wrote, most of his books in his last 14 years of life. He said that knowledge is either sensitive or of opinion. You either get it through your senses, or with your eyes or your ears or whatever, or you think about it, either one or the other. And he divided opinion into two pieces, and we'll get to that shortly. But the only thing he felt, which could not be an object of knowledge or opinion, which cannot be thought about in any way except negatively, is that which has no being of any sort, in short, nothing. So he thought everything could be known. Not all the philosophers thought that. But John Locke divided his philosophy into the sensitive on the bottom, which was through the sensations, and the two that were thought about, intuitive, which is that immediately grasp, and remember Socrates told us that too, and demonstrative, knowledge that you can arrive at through deducting it, through deduction. Each person can know their own immediate existence at any time. We can know that God exists, and we can know that things externally are gathered by our senses actually exist also. So all of this knowledge is combined into ideas. The ideas are the next step, and then if you combine the ideas together, you get to complex ideas, associations, abstractions of simple ideas. All knowledge and ideas upon which it rests are derived from experience. Hence, the need to be in grade with what we do. So how do we go about, these are the cliff notes again, how do we go about doing good and doing no harm? Well, we have to find out what good and evil means, and that's actually turns out to be easier than some of the other things. Even though in the Webster Dictionary today, there are 42 different definitions of good, different connotations of good and so forth. But all point to something being favorable, honorable, or worthy. And included in that list are those things that are morally excellent and virtuous. Evil, of course, is the opposite of good. The conformity or disagreement of our voluntary actions, to which law whereby good or evil is drawn upon us from the will and the power of the lawmaker. In other words, when we see something that comes in, we relate it to what we already know. And then it's up to us to think about whether or not it's good or bad. John Locke divided it into divine law, civil law, and the law of opinion and reputation, which actually is virtue and vice. Each thing, insofar as it is in itself, endeavors to preserve its being. In other words, all of us, the reason that we are existing today is because we run through situations and we make sure that it's not going to hurt us. And those are morally good things to do, to take care of yourself and to take care of your family and so forth. The basic impulse or drive is identical to the actual essence of the thing itself. In other words, it's inside us and we try to preserve it. Spinoza, a little bit later, about 100 years later than Locke, came out with the idea that ideas were either adequate or inadequate, but only ideas that could be clearly conceived and distinguished can be fitted coherently and systematically and with apprehension of the whole of reality. In other words, he had an idea of the whole of reality, which all of us do have. And when we have an idea, we compare it to what we feel is the whole of reality to see if it's an adequate description or if it's not adequate, if it's good or if it's bad. These ideas are adequate, that are with this description, and scientific knowledge is possible only through adequate ideas. So, I pose these questions to us today. Are things that hinder gaining knowledge about the patient, like not being able to take a thorough history, do a thorough exam, follow a patient's treatment plan, or modify a patient's care, are they evil? That's food for thought. Going on to acting honorably and virtuous. I never knew what virtue was until I started reading through everything. And the people that founded our country and all these philosophers had a clear view of what virtue was. And it essentially is acting honorably. So you have to know what's good and what's evil so that you can act honorably. Otherwise, you can't act honorably unless you don't know, unless you know exactly what's good and what's not good. Virtue is good, vice is evil. Virtue and praise go together, as do vice and blame. But virtue and vice differ between different societies. That's just the way it is. We have to live with that. If we go back in time, back to the BC area again with Plato, Plato had 4 virtues that he wrote about in the Republic: temperance, courage, justice, and wisdom. Virtue is seen as the quality that makes men good, extending to his mind as well as his character, to the sphere of thinking and knowing, as well as to desire, emotion, and action. He thought, his student actually, Aristotle, thought that there were 3 types of, or you could gain virtue but through 3 ways. Either you were born with it, you could habituate it, in other words, do the good things over and over and over again and become virtuous that way. Or you could teach it to somebody. Or you can learn it from somebody too. Actually, you need all three of those, and he came up with that conclusion at the same. We get this, all of these ways are how we get to be virtuous through knowledge. One of the more recent, you might not think that the late 1700s was recent, but Immanuel Kant was born in Prussia of Russia, and his theories of knowledge stressed the role of sense experience, just like Locke's. But he also saw that the mind could add to knowledge through the pure forms of sensibility, space and time, and the understanding, cause and effect. He was one of the people that mixed rationalism with empiricism. Locke was more of an empiricist. Kant was more of a rationalist. But Kant actually was the bridge, if you will, between empiricism and rationalism. People are not acting morally if they just think that their actions are moral, but only if they understand the underlying moral ethic. You got to think about that one for a while, because that means that we might think we're doing something good, but it might not be so good. You have to think about what the underlying prospects are happening. Total responsibility was placed by Kant on the individual to know the reasons why some actions are considered ethical and others are not. The individual must do the reasoning. So, in our country today, this is where we are. We have Medicare that came to us in the 60s. We have Medicaid that came to us in the 70s and 80s. We went through an era, not even an era, a few years, maybe 5 years or so, where we had procedure codings in the 1980s. I was on one of those committees at the academy where we had to code everything that we thought we were doing, or that the government thought we were doing. Then we had command and control. Essentially in the 1990s, the medical field, if we had any influence of what was happening, we pretty much lost it at that point in time. The insurance companies and the government took over. We now have protocols, which are guidelines, which have become requirements. We have financial burdens, and now recently we have electronic records. So how do we, intervene here to keep the patients and all of us together so that we can do our work? We have accountable care organizations that have taken the place of HMOs, and the HMOs failed in the 80s, but of course these are going to be better. The doctor is going GALT. We essentially, whether we like to say it or not, we have a two-tiered system. Concierge medicine, a fancy word, but essentially the people that can pay for it are paying for it, and the rest of us are, going with our insurance companies or get what's there. And right now we have really an unsustainable medical financial system that really nobody is talking about, which is, if you listen to the people who really understand what's going on, over $210 trillion in the hole. Where has that money gone? It's been kind of frittered away. And all of this we have in the face of systems that we've seen around the world, in Europe, Canada, the US VA system, and I forgot the Native American system of health that we have in our country. So the divisions, so if you go back and you think about the divisions that are actually in the medical system, and talking about medicine now, not how we get knowledge, not how we're good and evil, and not how we're supposed to wax philosophically and so forth and so on. But you can either have, in any medical system, you can either have excellent care, immediate system entry, where you can see somebody immediately, and low cost. Those are the things that everybody wants. Well, there is no utopia. You can only have 2 out of 3. And this was one of my mentors that told us way back 40 years ago. And he had come from Canada and had thought about this already and immigrated to the U.S. and became on staff at the clinic. And he said, that's it. I mean, we all want excellent care, immediate system entry, and low cost. But there's no way that you can get that. There's absolutely no way to get it. So you have to pick and choose. And I think it's up to us, not as the givers, if you will, but now speaking as patients, to choose what we want. So, not to leave us on a real down note, or was it that we're just getting hungry and everybody's sleeping? So, but I wanted to go through some things that, in thinking about this, I think the best way that we can maybe regain some of the things that we've lost is to work from the grassroots up and not from the top down. Everybody else is working from the top down, and I think we need to try working from the grassroots up. How do we do that? Well, you do it patient by patient. We all do it together, and we do it patient by patient. So I put down some things that I've learned through my career that are, I think, important to keep the doctor-patient relationship, the SLP-patient relationship, and so forth and so on, to keep it strong. We have to listen, we have to be attentive, and make eye contact. Eye contact is very important. I learned from my dad, after I thought about it, that he was great at making connections with people. And the way he did it was that he would either try to figure out where they were from, or what they did in their life, or if they knew somebody that they both knew together, or did they visit some place that they could talk about. He made connections with every patient. I think back to one of the surgeons I rotated through with during my internship, and he was Dr. Judd. He was the son of one of the original Mayo people. We have the Weber Judd drugstores in Rochester locally. But Dr. Judd would remember every one of his patients. And how did he do that? Because he remembered one thing about the patient, not necessarily their name, because he didn't remember names very well, but he remembered maybe that the daughter had gone to that school, or that they had a dog that was really a nice dog, or the same kind of dog. He would immediately know, by making that connection, that he would remember everything that he did there in that surgery, and he would remember everything that that patient had done, in their interaction. He could walk right into the room and talk to them as if he was a family member. That's what connection is. If you have to take, and I have to, take short history notes by hand, if you're on a computer, you're not looking at the patient. And if you're not looking at the patient, and this is something we have to live with. if you're not looking at the patient, you're not making that second thing, which is the connection. And the reason it's the second thing is because it's important right after listening. Be able to smile when appropriate. Appropriate's the key word there, I guess. And use humor to lighten the fear. The patient, when they come into the room, we all heard it in the past, but until you become a patient again, which I have been a couple of times since I've retired, until you become that patient again, you don't remember that if the doctor can, or whoever's taking care of you can break the ice, you're fearful of what's going on because you don't know what's going on. Otherwise, if you did know what was going on, you wouldn't be in the office. Is it over? Thank you. Use your experience to guide you in the process of trying to figure out what's wrong. And, excuse me, in doing the physical exam. Give the patient feedback. They want to know, and the first thing they want to know is, are they going to die? Essentially, they'll come in with a sore throat and they want to know if they're going to die. I mean, this is stuff that goes through your head. The worst mistake, and actually probably the first mistake I ever made, and maybe the only mistake I've ever made. No. I say that to Connie all the time, my wife. The first mistake I made was early in my career, probably 2 years out, and I had just got done doing a huge head and neck cancer surgery on this man from Chicago. And his wife was upstairs, and he had a big tongue, jaw, neck tumor. We took out all of this stuff, we put him back together again, he looked fine. And I got on the phone because at that time we didn't have people that, nurses that ran around and said, yes, they're doing fine, and again another 2 hours or whatever they say. And I called up and I said, Ms. Johnson, I'm sorry. This is the first thing I said to her. And she fainted. And the nurse grabbed the phone and said, what did you say to this person? And so you learn early that you have to give appropriate feedback. You tell them everything went fine, and then you tell them again. Because the only thing they're probably going to hear is everything that went is going fine. And support. You address the patient's symptoms and give their patient value. When you go into the room, because the patients know their own bodies better than you do, even though you know medicine or your field, the patients still know themselves better than you do. Give them all the treatment options. We all know this stuff. I'm bringing it back, I hope. When they say, what would you do, doc? Then you can tell them what you believe is the best course. Because most people will ask that question. And then you give them the treatment plan, and at that time, you use all of the stuff that Hippocrates used. You used where they're from, what kind of diet they're on, what kind of build they have, male, female, all of that stuff. Everything, you marry that person into the treatment plan and how far away from you they live if they have to go through a treatment. The acrostic that we have for that in Greek is LCNHKFST, means absolutely nothing, so you can forget about it. The patient will make the final decision, as they should, and it will be the right one for them. So in conclusion, life is short, the art is long, the crisis is fleeting, The experiment is perilous, and the decisions are difficult. The physician must not only be prepared to do what is right, but also to make the patients, the attendants, and the externals cooperate. Thank you very much.